Welcome to today's video, where we'll be discussing a rare but significant condition affecting the eyes, lymphangioma. We'll explore what lymphangiomas are, what causes them, how they're diagnosed and treated, and what you need to know about living with this condition. The exact cause of lymphangioma is not fully understood, but it's generally believed to be a congenital condition. This means it's present at birth, though it may not be immediately noticeable. It's thought to arise from a malformation of the lymphatic system during fetal development, leading to abnormal collections of lymphatic vessels. Let's break down the pathophysiology. The lymphatic system is a network of vessels that helps remove waste and fluid from tissues. In lymphangioma, these lymphatic vessels don't develop properly. They become dilated and cystic, forming tumor-like masses. These masses can then affect surrounding tissues, including the eye and its associated structures. In the eye, this can manifest in the conjunctiva, orbit, or even the eyelids, depending on where the lymphatic malformation is located. Lymphangiomas are rare, and precise epidemiological data, especially for ocular lymphangiomas, is limited. They are most commonly diagnosed in childhood, often before the age of 2. There doesn't appear to be a significant difference in prevalence between males and females. Due to their rarity, large-scale studies on specific risk factors are challenging. The signs and symptoms of ocular lympangioma can vary greatly depending on the size and location of the lesion. Common symptoms include swelling around the eye, which may be painless or cause discomfort. Patients might experience proptosis, or bulging of the eye. Diplopia, or double vision, can also occur if the lesion affects the eye muscles. In some cases, there may be conjunctival lesions, appearing as small, clear, or blood-filled blisters on the surface of the eye. Bleeding within the lympangioma can cause sudden increases in size and pain. Diagnosing lympangioma typically involves a thorough ophthalmological examination. This includes assessing visual acuity, eye movements, and the appearance of the eye and surrounding tissues. Imaging studies, such as CT scans or MRI, are crucial for visualizing the extent of the lesion and differentiating it from other orbital masses. Biopsy, where a small tissue sample is taken for examination under a microscope, may be performed to confirm the diagnosis and rule out other conditions. Lymphangiomas can be broadly classified into different types based on their size and the type of lymphatic vessels involved. These include capillary lymphangiomas, cystic hygromas, and cavernous lymphangiomas. Ocular lymphangiomas don't always fit neatly into these categories and are often described by their location, such as conjunctival or orbital lympangioma. Sometimes, they are classified based on the size of lymphatic channels involved, with larger channels often leading to a more cystic appearance. Treatment for lympangioma depends on the severity of the symptoms, the location of the lesion, and the age of the patient. Observation may be recommended for small, asymptomatic lesions. For more significant cases, treatment options include surgical excision, sclerotherapy, where a sclerosing agent is injected into the lesion to shrink it, and laser therapy. In some cases, medications like sirolimus may be used to manage the condition. Multiple treatments may be required, and recurrence is possible. As a congenital condition, there is no known way to prevent lympangioma. Prenatal care and genetic counseling may be beneficial for families with a history of lymphatic malformations, but these measures cannot guarantee prevention. The prognosis for ocular lympangioma varies. Small, stable lesions may not require treatment and have an excellent prognosis. Larger or more aggressive lesions can cause significant visual impairment and may require multiple treatments over time. Recurrence is a common challenge. Recent research focuses on exploring targeted therapies, such as sirolimus, and improving surgical techniques to minimize recurrence and preserve vision. Ongoing clinical trials are crucial for developing more effective treatment strategies and improving the long-term outcomes for patients with this rare condition.